that may be a good place to finish because it is complicated. And I think that over the course of the conversation today, we've introduced that complexity at so many different levels. I think there was a lot for the viewers to take from this. Again, this was great. It was informative. I had a lot of fun. And it's when you can both inform and to some degree entertain, especially since we're doing everything virtual these days. You can't ask for more than that. My thanks to all of you for this rich and informative discussion. Before we conclude again, I want to go around the horn, kind of 30-second final thought on kind of the future of biosimilar. And we'll go reverse order. So we'll start with Karina, then Kathy, Michael, and Bhavesh. Karina, you're on.
Thank you, Bruce. Just to echo what everyone else has said, I think that, strategically, we are looking at a 1 to 3 year plan to go ahead and disrupt the market a little bit and really make room and make decisions that do look at overall cost of care in a long-term method.
Kathy.
Okay. I encourage everyone, we believe in the science, the innovation, and we do believe that biosimilars have a place in our long-term strategic plans to help bring down healthcare costs for the system and payers as well as the patients.
Michael.
We believe that biosimilars have the potential to permit us to be able to provide higher value care or high value care that is, at a more affordable cost to patients in society. And I think that it is an invaluable tool that we can add to our arsenal as we try to figure out the best ways to take care of our cancer patients. And so I'm glad they're here. They're here to stay, and we want to do everything we can to encourage their use as appropriate.
Bhavesh, first and last word.
What I would kind of want to see happen is more real world evidence being published by health systems and providers of their experience with biosimilars, which would really kind of help the adoption rate to increase, because that is really tied to the cost savings that we want to see to adopt the innovation that we have. And I think that, one of the biggest challenges that we have not addressed till this day is actually having payers control the market. And until that actually is taken away, I think that we're still going to have this impedance of adopting biosimilars to the full extent that we need to, that providers want to. So I think that that is going to require some government regulation. But essentially, I think we're going to be not even talking about a biosimilar in a couple of years, where we're going to be using multiple biosimilars 1 week, next week, the next month. So this is going to be all obsolete eventually, hopefully.
Thanks, Bhavesh. And thanks everyone on the panel. Thanks to our viewing audience. We hope you found the Center for Biosimilars peer exchange discussion to be useful and informative and maybe a little bit entertaining. I'm Dr. Bruce Feinberg. Be well, everybody.